Have you been told that you have a disc bulge? Do you know what a disc bulge is? Do you know how a disc bulge even occurred? And do you know what can be done for a disc bulge? My name is Dr. Alykhan Shariff, and I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And today my topic is going to be disc bulges. What are they? How do they even occur? How do I even know I have a disc bulge? Well, let's understand the disc for a second first, okay? If you look at your disc, you'll see that there's vertebrae, and between each vertebrae, there's a disc, okay? And that disc, okay, has a couple of components to it. It is fibrocartilaginous. So the outer area is extremely tough. It's what's called the annulus fibrosus. It is extremely tough material and attaches itself to the top and bottom vertebrae. But then the middle part of the disc, that is gelatinous, and that's what we call nucleus pulposus. That's what it's called. And at birth, it's 80% water, okay? And that little jelly area in the middle is where all the compressive forces come down on the disc, okay? That's what handles everything. That is what we call your shock absorber, okay? So when you're doing stuff, whether it be heavy load stuff, lifting, things like that, but even just standing in general, there's gravity on your force. It could be also the way you bend forward. It could be the way you sit, slouching. All this stuff puts stress on that disc. And what can happen is that your disc will start to bulge. The best example I can use is if you took a balloon, okay, and you fill the balloon with water, and you squeeze one area of the balloon, the other area of the balloon starts to bulge. That's exactly what happens with the disc. It's like a balloon filled with water. You squeeze one area, and that's the compressive forces that your body goes through. The other side bulges. So a lot of us have disc bulges. We all have disc bulges, okay? But it's when the disc bulge gets so big that it impinges on the nerve. Because what happens is, there's nerves exiting the spine, okay? And when that disc bulge gets so big, that disc bulge can start to irritate that nerve, okay? Because that disc is inflamed. And so that's what a disc bulge can do. But you could have a disc bulge and there could be no discomfort because that disc bulge is not big enough to affect that nerve. So really, a disc bulge may be a healthy symptom or a healthy occurrence that may not be affecting you. It's when that disc bulge is so inflamed that it's affecting that nerve. And as a chiropractor, that's what I try and figure out and try and see what I can do for you. And in my clinic, I'll do an extensive exam, I'll do a history, I'll do a physical exam, I'll do x-rays, and I'll do a complete computerized spinal scan to help understand what is going on. And a lot of times patients will bring me in their reports. They may bring me in MRI reports, CT scans. I want to see it. Bring it in. Because the more I know about you, the better I can help you. And then from all of that, I then put together a therapy plan on how I can assist you, and I can inform you on how well you're going to get. And we work towards that in terms of getting you better, okay? So if you've got a disc bulge, then for sure chiropractic care is something you should consider. If you found this video helpful, because when it comes to disc bulges, it's a common term I hear, and a lot of people don't even understand what it is. So I love for people to watch this video to understand more. Again, my name is Dr. Alykhan Shariff. I'm a local chiropractor in Oshawa, Ontario, and I look forward to giving you more tidbits of information. My clinic name is Infinite Healing Chiropractic and Wellness Center.